Hi, Dr. Christopher Maloney talking to you about ear infections. Now, ear infections are something I see completely underdiagnosed, and I actually make a practice of looking at all my patients' ears, and I see an overwhelming number of patients with some level of chronic ear infection. These are red, bloody ears with liquid behind the eardrum. Oftentimes the whole families are having it. They're not experiencing acute pain, therefore they assume that this is just, a normal situation. And what I would recommend for any family member is when I've taken my patient and my family to pediatricians and other people, is that I see a quick look in the ear and, oh, he's fine. I wish that we could train the general populace to look in each other's ears, because what happens is that it's the kind of thing that when I've shown mothers and fathers what's happening in their children's ears, they know what it looks like when it's bad. It's not that hard to tell. The ear is basically full of bloody vessels and there's pus behind the eardrum. It's really not that hard to tell that there's something wrong. But what happens is that because we've really kind of moved away from giving antibiotics for what are overwhelmingly viral infections in the ear, there really isn't much that standard classical, conventionally trained MD can do. So there really isn't, do you have an ear infection or not, is not helpful. What we want to know is, how do I get rid of it? And in that model, what we're looking for over and over again is some kind of antiviral model. And truthfully, there's a whole bunch. If you look on my website under colds and flu prevention, you'll see a whole range of things that you can do in terms of your lifestyle and things to do with your children to help them feel better. It's really possible to have a child not experience chronic ear infections one after another, but you need to focus on a broader visual image rather than just the ear itself.